WebMD has just had a study showing that suicide has gone up amongst white baby boomers in the U.S. And the reason they attribute to this is alienation and blah, 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 blah. But right next to this study were ads for every possible antidepressant that could be sold. Now, let's put two and two together here. The antidepressant drugs drive people to suicide. So maybe the increase in suicides we're seeing in the U.S. amongst white folks is because they can afford to go to docs more than other folks can, and because maybe more white folks are on the antidepressant drugs than are other races. The antidepressant drugs are known causers of suicide. That's one of the things that was known back when they first came on the market in '93. And now it is one of the things that is warned about when prescribing these drugs. Yet that particular aspect of drug-related suicides wasn't touched on at all in the study, and I have to ask myself why. I'm scratching my head going, wait a minute. Did anyone bother to look into the fact to see if these folks who had committed suicide, to increase the suicide rate amongst white middle-class folks in the baby boom generation, did anyone bother to look to check and see if these folks were on the antidepressant drugs? We need to go back, and we need to re-look at the patients in that study, and we need to see if they were on antidepressive medication. They blame all sorts of other stuff. Folks, if you're on antidepressant medication, be mindful of the fact that it may drive you to kill yourself, as well as we already know that it can drive you to kill others. One also needs to look at the general lack of faith that has been happening in white middle-class America to see where the hopelessness that leads to suicide is coming from. When all people believe in is in work, in attaining, in materiality, and they have absolutely no faith in God, no belief in God, nothing, no safety net to help them when they hit dead rock bottom in some sort of an emotional crisis, then all of a sudden, the only comfort, the only way out, seems to be to kill yourself. And I think that if we looked into that factor as to the faith of the people who did commit suicide, I believe that you would find that most of them were very shallow in their faith, or agnostic, or atheistic. People of faith have a support system. People of faith have a safety net. People of faith have something to live for the day after tomorrow. People of faith know that they can hit dead rock bottom, and God will be there to dust them off, pick them up, and get them back on the road to a full and happy life once again.